Hi, my name is Morgan Davis, and I am doing a study on concussions and mental health in Division II student athletes. The purpose of this study is to determine if a relationship exists between concussion rates and health-related quality of life indicators. The relationship between concussions and mental health has been a topic of recent interest. Multiple concussions are linked to mental health diseases such as Alzheimer's disease, depression, and mild cognitive impairment. Determining how concussions and mental health affect each other can help sports organizations better enact policy that will protect the long-term health, safety, and well-being of current and former athletes. Retired NFL players who reported multiple concussions had a higher rate of memory problems, depression, and mild cognitive impairment than the retired NFL players who reported no concussions. NFL players who claimed to have suffered concussions had a higher rate of Alzheimer's disease compared to other males in the general population. McLeod, Bay, and Snyder investigated the relationship between concussion rates of athletes and health-related quality of life. McLeod noted that health-related quality of life takes into account the physical, psychological, and social domains of health. It considers the whole person and addresses disability and societal limitations. When testing health-related quality of life on athletes and non-athletes, athletes scored higher on all the subscales except for bodily pain. Athletes who reported a concussion or multiple concussions in their past had lower health-related quality of life scores, mainly in the subscale of mental health, and more headaches in their general health. Depression and fatigue symptoms were at a high rate, and cognitive and emotional functions were lower in concussed athletes 3 days after they received their concussions. The health-related quality of life will tend to stay low for months and even years if there have been multiple concussions. The instrument that will be used in this study is a mixture of two different instruments. The first instrument is a few questions on concussions, such as how many has an individual had and how long were they held out of their sporting activities. The other instrument is the RAND-36 short form, which is used to measure an individual's health-related quality of life. Participant responses are scored in each of the 8 health concepts, which are physical functioning, bodily pain, role limitations due to physical health problems, role limitations due to personal or emotional problems, emotional well-being, social functioning, energy fatigue, and general health perceptions, as well as an overall health and health-related quality of life score. I am interested to see if gender, academic status, and sport affiliation makes a difference in the number of concussions received. I am also interested to see if gender, number of concussions, and concussions in general have an effect on health-related quality of life scores.